We're here for Samsung's sponsor spotlight, which is unlocking AI's potential for a healthier you. So welcome. I really appreciate your time. AI is inevitably, understandably, a huge part of this conference, a huge part of the conversations that we're having here. So can you tell us how technology and AI can support health and wellness, why that's not at odds or there's not a contradiction in that?
Sure. Great to be here. I think if we look at the major trends, whether it's the aging population with increased prevalence of chronic diseases, you look at the cost of care rising, there's some major trends that clearly is causing care to shift to the home. I think that's a very clear signal that we have seen, and others, I think, agree. With that shift, we now need technology and AI to be able to help families take on the burden for that care in ways that have not been necessary. And so we think it's a problem, the care at home shift, but it's also an opportunity where AI and technology plays a role. And so if you look right now in the US spending, we spend about 25% of our budget on preventable disease that with lifestyle changes we should be able to avoid. And yet, how much spending do we do on prevention? 3%. Why the mismatch? Well, there are a lot of reasons, most of you probably know, but part of this issue is applying the, you would think it's 25-25, but there are challenges with spending those dollars on preventable diseases. But we think that the technology on the wearables that's continuously monitoring you, that can currently screen, but in the future detect diseases from right now, sleep apnea, arrhythmias, but in the future, cardiometabolic, and in the neurocognitive dementia area. So I think we have some huge opportunities to really focus on prevention. And I would say Dr. Leroy Hood's P4 medicine gives us a vision for what technology and AI can do, which is preventive, personalized, preventive, predictive, and participatory. And of that, I think prevention, I think, has always been an issue or challenge for us as a country, as a society. We think that and helping people meeting people where they are with technology, understanding the context, understanding the fallbacks and setbacks that we have in life because we're busy, and then getting them, nudging them to the goals. I think these are the things where technology is exciting.
You mentioned wearables, you mentioned prevention being such a priority. Is that why Samsung is so involved in this, why there's a passion within the company to be first in this space?
Sure. We're really committed to healthcare, and the reason, in part, was because care is shifting to the home where we have a trusted brand. So I would say trust and scale. One is we have 1 billion people using our device in their hands. We have 70% of US households that have one Samsung device or more. We have about 58 million monthly active users globally that are using Samsung Health app to take care of their health. Given that, our vision is to really what we call connected care centered around the home to improve the health of billions of people, connecting the devices and the data, the people and the services in a seamless way.
Where else can technology and AI play a role?
Yeah. I think, there's lots of areas, but, from where I sit, I think one of the biggest areas is about healthy aging. And healthy aging looks different for different people. For me, I want an assistant that knows me, that I have sometimes setbacks in a day, and knows that I need a little less nudging than some other days. So it's really about knowing the context, knowing where I am in my journey towards the goal. And so let's give a concrete example. Let's say there's a person, is a healthy person, a young person, who has a family history of dementia and other conditions. And so with the engine, with the capabilities, we're able to understand where they are and then be able to interact with food app, recipe apps, and other things to help you because there's risk of diabetes as an example. And so I think it's really about hyper-personalization at scale with context. That's probably what areas of healthy aging looks like.